Heart failure is failure of the heart to work up to the needs of the body. There are various types of heart failure like heart failure with preserved ejection fraction and heart failure with reduced ejection fraction. Former affects the filling of the heart while the latter affects the pumping of the heart. An important device used to support the failing heart with reduced pumping capacity has been called heart failure device, but the correct technical name is cardiac resynchronization therapy. It is not to be used in all types of heart failure, only in specific subgroups of heart failure. Cardiac resynchronization therapy (CRT) is used when the contraction of the left ventricle has lost its synchrony. Left ventricle is the lower left chamber of the heart which pumps oxygenated blood to the whole body. In several patients with heart failure, there is lack of synchrony between the contractions of different parts of the left ventricle. When one part contracts, other part would not have started contracting. Only if all parts contracts in their normal sequence will the pumping function of the left ventricle be good. If there is dyssynchrony, it results in wasted contractile effort of the left ventricle and leads to heart failure. Now, how do you find out synchrony of contraction of the left ventricle? Echocardiography or ultrasound study of the heart is useful in finding out the sequence in which different parts of the ventricle contracts. There are different advanced modes of echocardiography which are available for this purpose, though it is time consuming and not always accurate. More common surrogate of dyssynchrony, which is mentioned as the criteria for implantation of CRT, is the width of QRS complex on the ECG. QRS complex represents the electrical activation of the ventricles. So, if the QRS is widened, it is presumed that there is dyssynchrony. A left bundle branch block pattern on ECG with wide QRS complex is the often cited criteria. Left bundle branch block is the electrical block in the part of the conduction system which takes signals to the left ventricle. Please view the full version of this video at my Cardiology Talks channel and subscribe for updates. Useful for early career medicos and paramedics. Link given below this video.